Thank you all so much for joining the Health, Hospitals, and Social Services Committee meeting. Today is Tuesday, February 4th, 2020. I detect a quorum, and I thank you all so much for being here. Our first order of business is Resolution RS 2020-180, Mendez, Hurd, and others. Approves a subrecipient grant agreement between the Metro Development and Housing Agency and the Metro Department of Social Services Homeless Impact Division for one-time payments of first month's rent and security utility deposits on behalf of homeless persons obtaining housing for various campaigns.
Motion.
Second.
It's been properly moved and seconded. I don't see Judy here, but we all know that this homeless situation is one that's very much needed some attention, and we're very happy of what it is that's being done to support it. So with all of that, and all in favor, say aye.
Aye.
Any opposed? Thank you very much. The second order is Resolution 2020-187, Mendez, Hurd, and others. Accepts a grant from the United States Environment and Protection Agency to Metro Board of Health for ongoing collection of data on ambient air concentrations for fine particulate matter in Nashville, Tennessee.
Move.
Second.
Thank you very much. Mr. Sharp.
Those monitors, we've got some that just look at gases, particularly ozone is what they're looking for. This one actually looks at particulate matter. That stuff can get in your lungs and not good for you. They pay it in dribs and drabs from the feds as the amount comes available to them.
Okay.
That's a piece of that.
Okay, great. Thank you. Any questions? All in favor say aye.
Aye.
Any opposed? There being none, thank you. Resolution RS 2020-188, Mendez, Hurd, and others accepts the Bob and Diane Hoover Annual Innovation Award Grant from Pet Health Services to the Metro Board of Health to acknowledge animal life-saving initiatives for the betterment of animal welfare through the development or application of technology.
Move.
Second.
All in favor?
Aye.
I'm sorry.
That's one that our veterinarian made a suggestion to the software vendor about ways that they could do their business better, and they think it'll save them a lot of money. And they actually awarded that to her, and she said, well, I can't take it individually, so it's routed its way back to the shelter.
All right. Any questions? Thank you. All in favor?
Aye.
Any opposed? There being none, thank you very much. And that is...
I have one question.
Yes.
184, 85, and 86. Shows that on our agenda.
That came through.
Oh, I'm sorry. I missed the whole page.
Yeah.
Come on, I got...
Hold on. I need to find out where I am on my bill.
Okay, I'm sorry.
That's all right.
I'm sorry. Well, we can go ahead with the discussion. This is RS 2020-184, Mendez, Hurd, and Welsh. This is a grant from the Tennessee Department of Health to Metro Board of Health to provide breast and cervical cancer screenings and diagnostic services to eligible individuals.
That's what it is. That is state money. Unlike a lot of these, that's not federal that flows through the state. That is actually state money. They do about 1,500 breast and cervical cancer screenings a year. They refer people for treatment if they need it.
Okay.
Okay, it's that to me is also a no-brainer. Are there any questions in regards to breast and cervical cancer screenings? All in favor say aye.
Aye.
Any opposed? There being none, the motion approves. Resolution 2020-185, Mendez, Hurd, and Welsh. This is a grant from the Tennessee Department of Health to Metro Board of Health to facilitate the planning, implementation, and evaluation of community-driven and evidence-based health promotion programs.
Motion.
Second.
Thank you. Mr. Shaw.
They do a variety of things in that program. They do breastfeeding education and awareness. They do. They staff the health and all policies group that we put together from Metro departments. They put together the community health improvement plan, which I encourage all of you to read and memorize. They facilitate the Health and National Leadership Council. They do a lot of things.
Great. Thank you so much. Anything, any questions or concerns regarding this community-driven and evidence-based program? All in favor say aye.
Aye.
Any opposed? There being none, our last resolution is Resolution 2020-186, Hurd and Styles. This is a contract between Well Child, a provider of vaccines, and the Metro Board of Health for MPHD to provide emergency backup storage of vaccines in the event of a power failure, equipment failure, or any other threat.
Motion.
Second.
So Well Child is a provider of what they call VFC program, Vaccine for Children program. And the feds, when they provide the vaccine to them, they require that they have an emergency plan for the vaccine in case the power goes out. It has to be kept at temperature. They need a backup storage facility. We've agreed to be that for them.
Okay.
We'll never have to do it.
Awesome.
We're
We
ready for you.
appreciate how you back us up. Thank you very much. All in favor, say aye.
Aye.
Any opposed? There being none, the meeting is adjourned. Thank you very much.
Thank you.
You took yours first.